Why should we care about men's health? Surely men are far more low maintenance than women. We live longer, we've got a higher muscle bulk, we're even allowed a greater daily recommended intake of alcohol than women. It may therefore come as a surprise that on average, in the UK, in the 21st century, men die about 4 years earlier than women. Men also tend to present later, are less likely to talk about sensitive issues, and are more likely to perceive seeking help as some kind of weakness. Let's start with testicular cancer. Well, to be fair, there have been quite a few well-run public campaigns in recent years. Don't just scratch them, check them out springs to mind. And thankfully, testicular cancer is actually quite rare, so a GP like me might only see one case every 20 years or so. The reason why self-examination has been so well promoted in recent years is really to increase awareness and to lessen the stigmata of the disease amongst men and their partners. We used to see testicular cancer presenting quite late. Thankfully, it's now more normal to see cases presenting early, and testicular cancer is a really good example of a cancer that is very treatable if you pick it up early enough. So you don't have to obsessively check your balls every week, but it's good to know what's normal for you. And if you do feel something that's new there, or a lump there that wasn't there before, or something that bothers you, get it checked out by your GP. At the very least, you might get to learn what all that other stuff is in there that you can feel. So how about depression? Depression is, by complete contrast, something that is not talked about often enough. We all have our low points, but it is not normal to feel stuck in a permanent state of low mood to the point where it affects you and everyone else around you. Now, there's no recognised male depression that's different to female depression, but men tend to deal with depression differently to women. We're less likely to admit that we don't feel strong. We're more likely to become angry, aggressive, or lose control. We're more likely to take risks. We're more likely to bury ourselves in work or use alcohol or drugs to cover things up. We're also more likely to commit suicide. Tackling depression does not simply mean a pat on the back and some tablets. For many men, it can be a wake-up call to really start looking at their lifestyle or situation and an opportunity to look at those problems from an outside point of view. This is one of the things that GPs are really good at helping with. How about something that's talked about even less often and is even more taboo? How about erectile dysfunction? Put simply, erectile dysfunction is the inability to attain and maintain an erection that's sufficient to allow sex. By this, we don't mean the occasional failure to perform. That's going to happen at some point in every man's life. True erectile dysfunction is when this is happening regularly, and like this, it affects men of all ages. Rather sadly, many men in their 50s, for example, believe it's a normal part of growing old and something you just accept. This is simply not true. The cause of erectile dysfunction can be purely psychological or non-organic, with no measurable test or investigation. However, the majority of cases of persistent erectile dysfunction are thought to have an organic or physical measurable cause. To maintain an erection, you need a good circulation. So, for example, erectile dysfunction can be the easily missed early warning sign of serious conditions such as poor circulation, heart disease, or diabetes, occurring sometimes years before the really major events further down the line. These conditions are still the major cause of premature death in this country, and they have hugely better outcomes if symptoms are picked up and treatment or prevention is started early. This can simply mean making the right changes in your lifestyle, which in turn can have a startlingly good effect on the presenting complaint, a return of sexual function. So what's the average amount of time it takes a man to seek treatment for persistent erectile dysfunction? Well, depending on where you look at, about 1.5 years, or sometimes up to 20 years, or not at all. What a wasted opportunity. So the message, if it's happening regularly to you, see your GP. You won't be the first. So, for the purposes of this podcast, we really only skim the surface of many of the things that we as GPs tend to see and talk about with our patients. But if something's happening regularly to you or isn't right, don't just try and forget about it. See your GP.